Limpopo Health MEC Dr. Phophi Ramathuba has been leading a team of specialists and subspecialist doctors who are distinguished experts to clear patient backlogs at the Pietersburg Hospital in Polokwane. It's an initiative under the Rural Health Matters Outreach Program aimed at complex surgical urogynaecology, urology, and also around the transfer of skills to the clinicians in the province. SABC News reporter Koketšo Motau has more for us.
We're coming to you from the Pietersburg Provincial Hospital here in Polokwane. This is where the MEC of Health in Limpopo, Dr. Phophi Ramathuba, is leading a program called Rural Health Matters. This is the program where they brought specialists from various institutions. Others are coming as far as Canada to come and assist people here in Limpopo who are actually in need of medical emergency. So I'm going to speak to Dr. Phophi Ramathuba now. Thank you so much for joining us here on SABC. Doctor, take us through the importance of this Rural Health Matters. We understood you launched this 2 years ago.
Thank you very much. Indeed, 2 years ago we had a dream, and it was around this month of August where I was supposed to celebrate my birthday, and doctors, specialists asked me, what is it that we can do for you? You have done a lot for me. And I said at that time, let 40 blind people see with cataracts. Indeed, they managed to operate around 80 at Elim Hospital where I was born. And then from there, it gave us an idea to say, indeed, people in the rural area deserve healthcare services. Specialist services must go there. We know our theaters are very limited here in this hospital, in this tertiary hospital. We're not able to deal with the backlog. At that time, when we had a hard lockdown for COVID-19, it was a real challenge. So when COVID-19 gives us a breather, we then would have to look into that. So this particular month of August, it's a month where we're celebrating women. We wanted to celebrate even women, female specialists like Dr. Evelyn Mushok. We all know that she's the first black woman to graduate as a urologist. Now, she also wanted to show the people out there that I'm very good with a knife in theater, not at the kitchen cooking. So this is our own way of celebrating Women's Month. Now, you also have got Professor Kruger, who's here. I said to Dr. Dagalo Muaba when the month started, I'm a woman and I'm an MEC. I've been appointed to be an MEC in a male-dominated, because the ruling party said 50% of you must be women. So probably I'm carrying in my shoulder the problems of women that have got to do with health. Hence I said to him, we need to give rural women a reason to celebrate Women's Month. I
want to bring in Dr. Evelyn Mushoko here, who was performing one of the surgeries there at the theater. I had an opportunity at least to actually watch her performing that particular surgery. Thank you so much for joining us, Dr. Mushoko.
Thank you. It's a pleasure.
Thank you. So take us through, what is it that you've been doing throughout this program?
My focus is very easy. It's more about urine and issues that have to do with it. That's why our motto here is that P well, be well. So that is our motto and our focus, for Dr. Mushoka Foundation. So the big thing that we are looking at is people who cannot pee, who are struggling, who are walking around with urethral catheters, who are isolated, who cannot work, who cannot be in relationships, who cannot have sex, who cannot have children, because they are leaking urine, they are walking with catheters which block, they are smelling, and that becomes an issue. So some of them, they actually will walk around for years. Like one of the cases that will be operating now, has been walking around with a catheter since 2008. So this, we find that, because they are not having cancer, they become last. Remember what is happening in the resources of our hospitals is that there are too many patients. Not only that, the severity of the diseases that they have is high. So in such a way that one case to treat will take longer. Long time in theater, long time to recover, and hence there'll be a backlog of cases that needs to be operated. So we are looking at this, that we can come on board, even working now over the weekends when there shouldn't be any activity. We have booked a lot of patients that will be operating. So what happens is we reduce on the backlog, we reduce on the waiting time, and that relieves the person who's in the rural space, that they can be operated by people with expertise in the field. Instead of them waiting for an ambulance to take them all the way far, we are coming to them to give them that reach. And doing this during the Women's Month, it's actually for me a big thing, because I'm saying, you know what, I am a woman, I love being pampered, but one of the things which I can use to love people is to use my hands, to use my skill. And not only are we giving this to the patients who are in need, but also to the colleagues who want to learn the skill, because together we can make a big difference.